On this Sunday night, the controversy over contact tracing. The plan to put the onus on those who test positive.
Without contact tracing, how are we going to rein this in?
As numbers spike in the two largest provinces. The dangers of the flu season and COVID-19.
I think we're all a little bit nervous about it.
Why doctors are asking Canadians to get the shot. Donald Trump's health.
I was concerned for possible rapid progression of the illness.
When doctors think the U.S. president can get back on the campaign trail. And the Green Party's new leader makes history, but faces many more challenges.
Global National with Robin Gill.
Good evening and thank you for joining us. Canada's Chief Public Health Officer has a stark warning. We're running out of time to prevent a major resurgence of COVID-19. New numbers out of Quebec show just how dire the situation is right now. For the third day in a row, the province is reporting more than 1,000 new cases. In Ontario, the province's daily count is 566. Despite the spike in cases, Toronto Public Health is changing the rules around contact tracing. If you get infected in Canada's largest city, you may have to break the news to your friends and family. Abigail Bimman explains.
In Toronto, cases are climbing so quickly, Public Health is now asking those who test positive for COVID-19 to do their own contact tracing, giving instructions about how to notify close contacts.
Given what direction our numbers are going, well, that doesn't bode well, does it?
There's no change to the handling of high-risk situations like outbreaks in long-term care and schools.
I, in fact, think this is going to erode public trust and confidence. There'll be an extremely high level of variation with that. Some people will be highly responsible. Some people, I'm guessing, won't do it at all.
Toronto is canceling or putting contact tracing on hold, and Ontario is telling us, close the testing centers, let's catch up on the backlog. That's illusory. That does not give us the information that we need to be able to protect our communities.
Our health system is in crisis.
In the nation's capital, where the case count is also high and testing lines long, Public Health confirms contact tracing continues. But neither Public Health, nor the province, nor the hospital that runs this test site would explain why it stayed open Sunday after Ontario's premier said all sites would be closed to walk-ins for 2 days as they transition to appointments booked online.
Those images, which we've seen across Ontario, really put public pressure on, but if it's only online booking, it's invisible. There's no way to know how many people tried to log on and couldn't, how many people tried to access a test and couldn't, and we don't know what happens to them after that.
In Quebec, case numbers topped 1,000 for the third day in a row. The country's chief medical officer of health put out a statement Sunday focused on Thanksgiving. Dr. Theresa Tam says, "We've got some serious planning to do." Though she didn't go as far as urging cancellations as the Prime Minister hinted at last month.
It's all too likely we won't be gathering for Thanksgiving.
Tam recommends layering up on clothes, heading outdoors, and keeping a picnic table length apart from those not in your bubble, and not to share food with them. Indoor dinners will be safest if small and select, especially in the country's hotspots. Abigail Bimman, Global News, Ottawa.
We're at a very crucial juncture in the pandemic. Cases are on the rise and we're entering influenza season. Experts are worried the healthcare system could be overburdened with that double threat. That's why they're encouraging Canadians to get the flu shot. And as Julia Wong explains, provinces have been stocking up.
The change of seasons brings with it some uncertainty. Canadians will deal not only with influenza this fall, but COVID-19 as well.
And this year we're facing basically two viruses that are fairly similar in what they look like, at least in the initial stages of disease. And we don't necessarily know what to expect. So I think we're all a little bit nervous about it.
Similar symptoms mean the only way to tell them apart is through testing. Some provinces have already faced COVID-19 testing challenges, long lines at assessment centers, and delays in getting results. Another concern is the potential impact both viruses could have on the healthcare system.
If you're really sick, then you will burden the hospital with a lot of flu cases. As well as on top of that, you have, because there has been reopening, you would have cases of COVID-19 as well.
Medical experts emphasize it'll be important to follow public health measures like physical distancing, wearing a mask, and sanitizing your hands. They say there's also another tangible thing Canadians can do to keep themselves and others safe.
If there's ever been a year for us to get vaccinated for influenza, it absolutely is 2020. This comes back to doing our part to try and reduce that burden on the healthcare system.
A recent survey done for the Canadian Pharmacists Association shows more people intend to get the flu shot this fall, 57% this year compared to 45% last year, and 34% say they're more likely to because of COVID-19. Provinces, meanwhile, are gearing up. BC is building up its testing capacity to deal with COVID-19 and influenza. For the first time, Alberta is offering a high-dose flu vaccine to all seniors in continuing care. And Ontario is ordering more than 5 million doses of the vaccine, 700,000 more than last year.
Please download the COVID Alert app. Please get your flu shot this year. It's absolutely critical.
All measures will be important, especially since health experts say it's possible to contract both viruses at the same time. Julia Wong, Global News.
The doctors treating U.S. President Donald Trump for COVID-19 say initially he was very ill, but his health is improving. Wearing a mask, Trump took a short drive outside the Walter Reed Medical Center in Maryland, where he's being treated, to wave to supporters who gathered outside. His doctors now say he could be released as early as tomorrow. That doesn't mean he'll be back on the campaign trail right away, but that may bode well for his Democratic rival. As Jennifer Johnson explains, a new poll shows Joe Biden is widening his lead.
U.S. President Donald Trump's doctors at Walter Reed National Military Medical Center are now giving a more transparent assessment of his condition, saying the president had multiple episodes over the weekend that required steroid therapy, typically given to people with more severe cases of COVID-19.
Late Friday morning, when I returned to the bedside, the president had a high fever and his oxygen saturation was transiently dipping below 94%. Given these two developments, I was concerned for possible rapid progression of the illness.
The White House was criticized for sending mixed messages about the president's condition Saturday. Dr. Connolly denied he was trying to hide anything. His medical team now says President Trump's vital signs are good, and he is tolerating the steroid and the experimental drug remdesivir well.
If he continues to look and feel as well as he does today, our hope is that we can plan for a discharge as early as tomorrow.
Looking pale but presidential, the president released a video reassuring Americans.
I feel much better now. We're working hard to get me all the way back. I have to be back because we still have to make America great again.
The White House is defending how the president and his staff rarely wear masks or physically distance at events and rallies. Some experts are pointing to the Supreme Court nomination ceremony last weekend for Judge Amy Coney Barrett as the super spreader for the virus, which has now infected the president, First Lady, and several others.
It hasn't been cavalier at all. We take it very seriously. It's why we give everyone coming to rallies or to events, we give them a mask. We check their temperature.
The president remains sidelined from the campaign as a new NBC News Wall Street Journal poll shows Democratic candidate Joe Biden's lead widening after last Tuesday's debate, 53 to 39%.
How you doing, man?
The Republican governor of Ohio, where the debate was held, says the White House never informed him the president or his aide, Hope Hicks, tested positive for the virus.
Well, they've not reached out to me. They've not talked to me about it, no.
Another member of the president's inner circle who traveled with him to the debate, Special Assistant Nick Luna, has also tested positive for COVID-19 as the number of White House insiders infected with the virus continues to grow. Jennifer Johnson, Global News, Washington.
In a setback for what was once the American epicenter of the COVID-19 pandemic, New York City is planning to once again shut down some schools and non-essential businesses. Mayor Bill de Blasio says he wants to rewind reopening in 9 neighborhoods, all in the boroughs of Brooklyn and Queens. These areas have a higher rate of testing positive. The closures could last 2 to 4 weeks. The plan still has to be approved by the state's governor. British Prime Minister Boris Johnson nearly died from COVID-19. Now he says the UK could see rolling lockdowns for years. He made the comments as daily cases in Britain soared over 10,000 for the first time since mass testing began.
In all candor, it's going to continue to be bumpy through to Christmas. It may even be bumpy beyond. But this is the only way to do it. It is still very possible that there are bumpy months ahead.
Johnson did provide some hope. He says advice from leading scientists in the UK suggests a vaccine could be available by spring. Japan's most famous fashion designer, Kenzo Takata, has died from COVID-19 complications. The founder of the global Kenzo brand died today in a Paris hospital. He retired from the fashion house in 1999 to pursue a career in art, but he remained one of the most respected fixtures of the Paris fashion scene. Kenzo Takata was 81. A major infrastructure project cleared a significant hurdle, and it could lead to more exports from Canada's oil patch. The Alaska to Alberta Railway would start in the heart of the oil sands and serve as a transportation corridor to Anchorage and then on to Asia. But as Mike Couture reports, a number of steps remain before the project becomes a reality.
There could soon be another way of getting Canadian oil to market. The proposed project is called the Alaska to Alberta Railway and would stretch more than 2,500 kilometers from Fort McMurray to the port in Anchorage. It's still in the planning stages, but the company is already talking about economic benefits for northern Canada.
This is going to bring 18,000 plus jobs during construction.
It's also being touted as a lifeline for other supplies to flow faster to northern communities.
Rail is capable of transporting grain, forestry products. You look along that line, there's all sorts of mining activities.
The project was just given a presidential permit to go ahead, but the issue could be on this side of the border. The Liberal government had been criticized by the courts for not properly consulting Indigenous communities on the Trans Mountain Pipeline project, leading to delays. While the Prime Minister points out no proposal has been submitted for this rail line, Trudeau says proper consultation is the foundation of Bill C-69.
Seeing off the bat whether there is a potential for a project before the proponent goes too far down the road and invests too much money in it, in something that is unlikely to pass, or find out early that perhaps there's a different approach that is better.
The opposition disagrees.
We've seen investment here in Alberta and across the energy sector flee in what is probably approaching the billions of dollars since this government came into place. So I have no faith that Bill C-69 will expedite this project.
Still, the Calgary MP says this fledgling project is providing hope in the oil sector as an alternative to the Trans Mountain Pipeline.
The pipelines and the rail have the ability to economically move the product to Tidewater. So they can complement each other, and yes, at the fringes, they'll compete with each other.
It all depends on future demand of petroleum products and how quickly, or even if, the rail line can get on track. Mike Couture, Global News, Ottawa.
California has set a new wildfire record. This year, more than 1.6 million hectares of land have been scorched. That's the most in a single year ever. To put that into context, that's nearly 3 times the size of Prince Edward Island. The previous record was set 2 years ago. All of this year's destruction has basically happened since mid-August. Right now, there are 23 major wildfires burning across the state. The fires have killed at least 31 people and destroyed nearly 9,000 structures, including homes and wineries. Coming up, the impact of COVID-19 on the mental health of Canadians. Tonight, a worrying picture is emerging on the impact of the pandemic on our mental health. New research shows levels of anxiety and depression are up as cases rise. Ross Lord dives into the statistics and looks at how people in one province have taken a particularly hard hit in this stressful year.
Now that the pandemic has become a way of life in Canada, there's growing evidence of its impact in a new survey of 4,000 Canadians conducted by mental health researchers.
Our goal was to really try to get a sense of how are people doing with dealing with COVID in terms of anxiety, depression, and other mental health needs.
Among their findings, 1 in 5 Canadians have been diagnosed with anxiety or depression. Anxiety levels have quadrupled since the pandemic started, and they remain 4 times higher than before the outbreak. High levels of anxiety are most prominent in Ontario, Newfoundland and Labrador, and in Nova Scotia. The The survey found high levels of depression are also most prominent in Nova Scotia. A surprise when you consider the virus has been almost non-existent in the province for months. Researchers say fear of the virus among Nova Scotia's older population helps explain their findings, along with stress from another source.
We had what was the largest mass shooting in Canadian history, the Portapique mass shooting, occurring during lockdown.
The gunman's partner told police he was paranoid about the pandemic. Among other findings, things that helped people cope, like so-called online kitchen parties, have worn off 8 months into the pandemic.
What worked for them in the beginning isn't perceived as working anymore.
Even the summertime weather didn't lower the levels of anxiety and depression.
I think it really doesn't bode well for this second wave we're now experiencing. And once winter starts to hit and people are socially isolating even more, the fear, of course, is that people's mental health will deteriorate even more.
The study says COVID-19 has shone a light on shoddy mental health resources that leave people on waiting lists to access support. The good news, compared to an earlier survey from April, this one shows more Canadians are confident they'll bounce back, suggesting those who can are ready to tough it out until conditions improve. Ross Lord, Global News.
Still ahead, the challenges facing the Green Party's new leader in the time of COVID.
You're watching Global National.
The next leader of the Green Party of Canada, Annamie Paul.
After a year-long race, the Green Party has a new leader. Annamie Paul, a lawyer, has made history by becoming the first elected black leader of a major federal party in Canada. She replaces Elizabeth May, who was the face of the party for 14 years. And joining me now is the new leader of the Green Party, Annamie Paul. First of all, congratulations. But as you know, there is so much to do. Your party managed to get 3 seats in the House of Commons in the last election, and the pundits always said the Greens were the ones to watch. And yet your party hasn't been able to get the traction that is necessary to hold some kind of balance of power. What will you do differently from Elizabeth May?
Well, first, let's keep in mind that this isn't an Elizabeth May issue. This is really something that is structural in our political system. The way that things are designed, we give people many more reasons to vote against a party than for a party, and we know that that's what happened in the last election, where over a third of people voted strategically. I think that this pandemic and all of the critical and urgent situations associated with it that would have been better served by our policies has given us a new case that we can make to people in Canada.
A big part of your party is about climate change. The NDP and the Liberals have had their own green plans, but all of that is overshadowed by the pandemic. So how can you bring the centerpiece of your party's existence back to the forefront?
The centerpiece of our party's existence, in fact, is our people and the needs of people in Canada. We need urgent benefits that we need to create structural changes so that this situation never happens again and that we're more resilient. And we've been talking about those things forever. We have been leading on social policy, and this moment in time has really demonstrated how incredibly important our social policies are.
You're running in Toronto Centre's by-election. That's Bill Morneau's old riding. How confident are you that you can win that seat? And if you don't win the by-election, how will you manage to lead outside of Parliament?
Well, I made the decision to run in this by-election well before the vote on the next leader of the party, because my roots are very deep in the riding. It's a riding that I was born in and my mother taught in. My grandmother worked as a frontline worker in the hospitals in, and it's a riding that has been profoundly neglected by candidate after candidate parachuted in by the Liberals. And so I ran because I believe that people in Toronto Centre deserve real representation. I ran because I believe that enough is enough. And so I hope that Toronto Centre residents will agree with me, and they have every reason to, particularly in the midst of this pandemic. And I have become a pro on how to campaign in a pandemic, and I'm looking forward to applying all of those skills to make our case to Canadians over the coming months.
Anna Paul, thank you for your time, and once again, congratulations.
Thank you so very much. Take care.
Up next, the young royals and their wild questions for Sir David Attenborough.
I like monkeys best because they're...
There's Canadian pride at the London Marathon. Brent Lakatos has won the men's elite wheelchair race. The Quebec native raced with his own specially designed wheelchair, crossing the finish line in 1 hour, 46 minutes, and 4 seconds. This is his first major marathon victory. Lakatos has 7 Paralympic medals under his belt, as well as 11 world track titles. The children of the Duke and Duchess of Cambridge got the chance to quiz David Attenborough about nature. Prince George, Princess Charlotte, and Prince Louis brought their wildlife curiosities straight to the acclaimed naturalist and broadcaster. It's rare to hear the young royal speak, and George cut to the chase.
Hello, David Attenborough. What animal do you think will become extinct next?
Well, let's hope there won't be any, because there are lots of things we can do when animals are reduced to and danger of extinction. We can protect them.
Hello, David Attenborough. I like spiders. Do you like spiders too?
I love spiders. I'm so glad you like them. I think they're wonderful things. Why is it that people are so frightened of them? I think it's because they've actually got 8 legs.
The virtual chat is part of a campaign to promote Attenborough's new documentary. Adorable. And that is Global National for this Sunday. I'm Robin Gill. Tonight, your Canada is the Brant Street Pier in Burlington, Ontario. We would love to see your corner of this country, so please send your photos to viewers@globalnational.com. Thank you for watching. Donna Friesen is back tomorrow. Good night.